Martin, how you doing?
Hi, Adam. Nice having you here. Welcome to Ashford.
Thank you. It's a beautiful lake behind us. Hopefully, people can see it clearly. Um, and thank you for inviting me into your home as well. Uh, what do we have here, actually?
Well, I
For
made a simple lunch with some rice and some kale and shrimp.
very nice.
And after the interview, you're welcome to take the kayak out on the lake. So,
It might be a little bit too cold, unfortunately. And plus, I can't swim. Michelle can swim, my wife, but I can't swim, unfortunately. It sounds like a weird thing. No one believes me, but I used to be able to swim when I was a kid,
oh,
and I forgot how to swim because I went so long without swimming.
well, that's strange. Yeah.
Yeah, everybody's like, "Oh, it's like riding a bike," but it's like, yeah, I'm like 100 some odd plus pounds from when I was a kid, and so the mechanics feel off to me. Um, but yeah, it's very strange. No one really believes me.
Well, it's too cold for swimming anyhow. So,
Yeah. So for people who may not be familiar with you, you want to introduce yourself?
yeah, so I'm a scientist. I'm a biostatistician and an epidemiologist. So I use how I'm interested in studying various health issues,
Mhm.
looking at designing studies, analyzing them, and then interpreting them.
Right.
And the two areas that I've been working most on are both in disease surveillance, how to quickly detect disease outbreaks, and then how to monitor them. So, for example, in 2015, there was an outbreak of Vigenous disease in Bronx, in New York,
Mhm.
and that was first detected with the methods that I developed. And I've been working with the New York City Health Department for a long time. So, and another one is post-market vaccine and drug safety surveillance, where you look at uh, after a drug or vaccine has been approved,
Mhm.
it has only been tested on like maybe 1,000 or 2,000 people. So there could be a rare but serious adverse event that you want to monitor. So after it's been approved, we monitor using electronic health records or insurance claims data to see everybody who gets this particular drug, and then you see what happens after them. And there will always be some people who by chance have a heart attack or a seizure or whatever. So you want to see if then are they more than you would expect by chance.
Right.
So you use statistical methods and epidemiological methods to figure that out. So I've been working on that for a few decades.
Oh, wow. And you were, until recently, you were at Harvard.
Yeah, I was a professor at the Harvard Medical School until they didn't want me anymore.
Yeah, and then of course, like how maybe people who are familiar with you who are watching this, we found out more so about you through COVID-19 and the Great Barrington Declaration. How did you actually connect with Jay Bhattacharya? Actually,
So we actually met at the White House
oh, you
first
know how
time.
that's where most people.
I would assume so, yeah.
Yeah.
So Scott Atlas was working at the White House trying to put some sense into the policy with having more focus, but doing more to protect the older people, but because they were at high risk, and opening schools and not shutting down the whole society because these lockdowns were against all the basic principles of public health.
Right.
And instead, we should have done a much better job protecting older people because even at the beginning of 2020, we knew that even though could get it and everybody would get it, yes, there was more than 1,000-fold difference in the risk of dying. So this was not dangerous for children or young adults, less than the annual influenza season,
Mhm.
like a typical. Because in the past, during an influenza season, usually between 200 and 1,000 children die from influenza every year, which is of course tragic. But we don't close down the whole society. We don't close down all the schools every year for that because we wouldn't be able to function.
Right.
So children and young adults had less risk from COVID than the typical influenza. On the other hand, older people, influenza is bad for older people, but COVID was much worse for older people.
Right.
So we should have done a much better job protecting older people while letting children go to school and do their sports activities or music lessons or dance classes or arts thing, and also let young uh, students and young adults just live close to normal lives. And that's what Sweden did more or less. So the Great Barrington Declaration was sort of modeled on what Sweden did. And
Mhm.
I'm a native of Sweden, so I was following very closely what happened there also.
Right.
And I was part of the debate there. I was afraid that Sweden would do the same thing as the rest of the world. So I was publishing in the major newspapers their op-eds to defend the Swedish strategy in the spring of 2020. And now we know what happened because we can look at excess mortality, which is the ultimate measure for success or failure. You take the mortality that existed before the pandemic, like the 3 years before, the 5 years before, and then you compare that with the mortality during the pandemic from 2020 to 2022, 23. And Sweden has the lowest excess mortality among major Western countries. So that's a combination of having fairly low COVID death, but also not having all this collateral public health damage on cardiovascular disease, on mental health, on diabetes, and also on cancer, although most of the cancer death that's due to lockdown we haven't seen yet. Because that doesn't happen immediately. So if somebody who didn't go to get the screening or treatment in 2020, they might not die in 2021 or 22, but they might die like 2 years from now instead of living another 20 years. So the cancer things, we're going to the excess cancer mortality due to lockdowns, we're going to have to live with now for quite some time.
Wow. Man, see, it's funny for me because you were at the White House. So a lot of times people are like, they're screaming into the ether, no one hears them. You're at the White House. Obviously, people know who you are, and you have expertise in this field. And yet they still, and it wasn't like you were the only one. There were other people like
plenty of us, yeah.
Yeah, there were plenty. And so for me, it's like, well, why did they ignore you? So I mean, I'm sure we all have our theories. I don't know if it was incompetence or if it was malevolence. And part of me says that I think there are outside influences outside of yourself who was looking at it from one particular standpoint, and then another where they were just looking for a simple fix. And the big pharma comes with the vaccine or says, "Oh, we'll start a vaccine right away," and they're looking at that quick fix. Boom, they'll make it, put it out, just put it in your body, and we'll be done with it.
Yeah, I don't know what was the reason, like the highest level, because I asked that question. If we look at the level of scientists, I understand it better, because most of my colleagues were in favor of agree with me, like that I know personally, most technologists. But there were a few things that made it very difficult. So when in the beginning of 2020, when I tried to speak up out in the US, I wasn't able to. I tried to write things and they wouldn't accept it. So there was a silencing of every dissenting voice among scientists. So I wanted to create an illusion of consensus, which was also the name of the podcast of Jay Bhattacharya. But they sort of pretended that all the scientists was the scientific, and if you didn't agree, you were unscientific or pseudoscientific, which was completely wrong. But then the lockdowns was driven by people like Anthony Fauci, the head of the National Institute of Allergy and Infectious Diseases, and he sits on the biggest pile of infectious disease research money in the world. And also by NIH Director Francis Collin, who sits on the biggest pile of medical research money in the world. So it was not so comfortable for scientists. So some people tried to, but they failed because they couldn't get through. Others never tried because they were afraid of the consequences, because they're depending on this funding from Anthony Fauci and Francis Collins. And they don't want to lose it because their livelihood depends on it. They have to feed the kids and they have to pay people in the laboratory and so on. So it's not just their own family, it's also other people. So I understand why many of them kept silent.
Right.
And in other countries it was similar, like in the UK, for example. Jeremy Farrar was very pro these lockdowns, and he was at the time head of the Wellcome Trust, which is the biggest private funder of medical research in the world. And then, of course, we have the Gates Foundation, which funds a lot of infectious disease work. And Gates was also very much in favor of these lockdowns. He doesn't understand public health at all.
I was told the opposite. I told we should listen to what Bill Gates says.
He understands other types of viruses, computer viruses, but that's quite different than.
Yeah,
than regular
exactly.
viruses.
Actually, that I guess that brings up something like in my head. I think of vulnerabilities. I have an IT background, so I'm always thinking about. I think about stuff like efficiencies, vulnerabilities, and to me, that the link between the scientific field and the federal government seems to be a vulnerability for the scientific field. You know, and is there any way to kind of break away from that dependency between the two?
So I think one problem is it's so centralized in that you have one person, Anthony Fauci, who controls almost all the money for infectious diseases,
Hmm.
and one person, Francis Collins, who controls it for medical research in general. And it's not that they approve every. I mean, it's not that they sort of read every grant and say yes and no. But they sort of control the whole system, so they can make sure things goes in their directions what they want.
Right.
So what we have to do is we have to have it less centralized and more decentralized. And we saw that actually during the pandemic that some of the best research that came out early answering important questions, for example, on the vaccines, how long do they last? And we've now noticed very quickly waning immunity from the vaccines.
Mhm.
So, and does kids transmit it? Does the mask works? Uh, how does immunity from having recovered from COVID compared to the immunity from the vaccine?
Mhm.
Well, we know that, as you would expect, you have much better immunity if the person who's recovered from COVID has much better immunity than the person who's vaccinated. You would be surprised if it was otherwise, but we know that also very clearly. And those studies didn't come from like the powerhouses of US and the UK. It came from sort of countries who was very good scientists, but were small on the edges.
Mhm.
Like for example, Denmark or Iceland or Sweden or also Qatar was a very important study that came out about the waning immunity. So they have good scientists, but they're not as dependent on the financial. They're not dependent on the NIH funding. They have their own sort of um, funding mechanisms. So I think
Right.
that sort of showed how important it is to have a decentralized system for research. So I think in the US, instead of having one NIH, we should maybe have 6 NIHs.
Hmm.
And then if one is headed by Anthony Fauci type person, well, that's too bad. But the other 5 would still be functioning. So you don't lose it all. You still have things that are operational. I think decentralizing the scientific community. And Sunita Gupta, my colleague who was the co-author of the Great Branch Lectures, she's been talking about the cartel system within science.
Mhm.
And it's not that there is one cartel for all of science. It's more that there are one cartel for each subset of science,
Hmm.
where the same group of senior scientists sort of control uh, all of the funding because they serve on the committees that decide who gets the funding, and they control who gets to publish because they either are editors or reviewers for the journals and so on. And in some of the areas of science, people are very friendly and very welcoming for new ideas. So it doesn't really matter to have this. But in other areas, they are very protective of themselves and don't want new ideas to come in. So we have to break that cartel system. I think one way to do it is to decentralize the funding, but another way to do it is to end the control that scientific journals have. So we have to find new ways to do the scientific publishing. Now it's just a big money maker for the publishing houses,
Right.
and it doesn't serve the scientific community. So we really have to change how publishing works, which goes hand in hand with how promotions also go happen in universities.
Speaking of universities, um, like we just mentioned before, you were just at Harvard. Um, was this, I don't know if I should say in your opinion, or was this something them letting you go? Was it something that has been long in the making, or was it really something that was sudden?
So what happened was when I published in Sweden, they didn't mind because they don't read Swedish, so I don't even think they knew that I was publishing op-eds in Sweden. But of course, when the Great Barrington Declaration came out, that was a success in the sense that we managed to pop the bubble and say there is no scientific consensus for these lockdowns.
Mhm.
But I had some of the people at Harvard and Harvard's Mass General Brigham's Hospital, um, where I worked, that they were not happy with me. But they didn't quite know what to do with me. So I guess they had a dilemma from their perspective. But I tried to sort of just do things on the national and international level. There was two colleagues who wanted to set up a debate with me and some of the other faculty who were in favor of lockdowns and school closures and so on. But they couldn't get anybody willing to do that, which I think is very strange and unfortunate.
Yeah.
Because if you have people with different views, you should discuss it in a polite manner. It can be very passionate. It's good if it's passionate, but in a polite manner. And instead, there were members of the community who was comparing my ideas with exorcism of sort of the religious throwing out devils from people. Like they thought it was as scientific as that, which was sort of weird.
Yeah.
But so they were not happy. And one disagreement we had was about the vaccines and infection and acquired immunity, or sometimes called natural immunity. We have known about that since 430 BC, during the Athenian plague. And so we know if you have a disease like measles or whatever, you have immunity. Either for some diseases are permanent for your whole life, like measles. For others, like the coronaviruses that we have been living with for a few, there's 4 coronaviruses that we already had before COVID that we've been living with for at least a century. There you don't get complete immunity, so you can still get sick, but then the next time it's not so serious. And usually people get it the first time when they are kids, so it's not so seriously. So this was bad because nobody had it as a kid. And therefore it was so serious the first time you got it. So we know about that. And when we wrote the Great Barrington Declaration, there were a group of scientists in the UK and the US who put out sort of a memorandum that they published in the Lancet. They call it the consensus memorandum. And they were questioning whether there were immunity from COVID. And to me, that was shocking because, one, we have known about such immunity for 2,500 years. Two, we knew that those who was infected during the pandemic, nothing bad would happen to them once they had recovered. So some of them died, but once they recovered, you had immunity, so you wouldn't have to worry about getting sick again. So that was sort of very, very shocking. And then when they started the vaccine mandates, they decided that even if you've had COVID, you have to have the vaccine. And that's unscientific and it's unethical. That's unscientific because it ignores infection-acquired immunity, which is superior to vaccine immunity. So what basically happened, you have these hospitals, university hospitals and universities. At the hospitals, the nurses will go and take care of COVID patients all through 2020. Some of them were exposed, they got sick in COVID. They were home for maybe for a week or two. They go back and take care of more COVID patients. And then some point later, the Harvard hospital bureaucrats, they decided that, no, you have to get the vaccine, otherwise we fire you. So that's unscientific because they already have protection that was better than the vaccine. So what they should have done, they should have hired people actually. Should have tried to hire people who already had COVID to work in hospitals and nursing homes where the most people who are most frail and higher risk would be. So that's what they should have done. And I argued that publicly. But instead they fired these people who had the best immunity.
Yeah.
Which is it's like a university doing this. It's like having the university questioning whether the earth is round or flat, which we have incidentally known for about 2,500 years also.
Right.
So for about the same amount of time. And it's also unethical because now there are problems with this COVID vaccine. The immunity wanes and there are adverse reactions and so on. And there's problem with how the clinical trials were done, which didn't properly evaluate mortality. But let's just assume for sake of argument, let's assume this is the perfect vaccine.
Mm-hmm.
Then it's really unethical to give it to somebody who don't need it. When, for example, my 87-year-old neighbor here, she hadn't gotten it yet. So they were mandating the vaccine for people who didn't need it, either because they had immunity or because they were 20-year-old student who had minuscule risk of dying from this.
Right.
At the same time as there were many, it was the shortest of the vaccine, and there were many people, both in the US, older people, as well as in other parts of the world where they didn't have enough vaccines. So a lot of the poor and middle-class people wouldn't get it. And the old people could have benefited from these vaccines. So in Brazil, other parts of South America, Africa, India, other parts of Asia, that's where the vaccine. So everybody who took the vaccine who didn't need it was sort of taking it away from somebody else. So that makes it very unethical. And if you're pro-vaccine, you should be against vaccine mandates. Which is sort of the opposite of what people think, that if you're against vaccine mandates, you have to be an anti-vaxxer.
Yeah. So I do appreciate you giving your explanation from a scientist standpoint. So I'll give you my explanation from a layman's.
Thank you. Well, you're a journalist also, so you understand I think you somehow understand society probably better than I do.
Yes, but it was before I dove into journalism. I was an IT guy. I was an IT manager for a small business. But I'm a consumer. I'm a consumer of news and things like that. And I remember asking a now former friend. That's what 2020 did. I asked a friend, and this is someone I always ask questions to, right? I'm very I'm not even trying to impose my thoughts. I'm asking questions because I'm trying to figure out, does this make sense? I said, I've been alive, I'll be 40 this year, a few years ago. I've been alive for, 37, 36 years at the time. I've never heard of 6 feet. Where did that come from? I've heard of, if you're sick, maybe stay home. I've heard of, maybe even some people, I know it's popular in Asia where they wear masks if they're sick, so maybe they don't cough directly on people or anything like that. But I've never heard of a specific number like 6 feet. Does that make sense? And I remember chastising me, don't be ignorant, and for quite some time, I'm like, listen, first off, they were disrespectful by how they were coming at me because I was asking a question. But I later realized that question and other questions were political. So whereas before, like anybody else, get a second opinion, right? That was no longer a thing. Natural immunity. Oh, you must be a Trump supporter. It just became asking a particular question to find where your political stance was. And all I wanted to know was, does this make sense? I don't care who votes for who or who you support. I want to know, does this make sense? Does this make sense for me as a relatively healthy young man? Or for my son? Does it make sense for him to get injected with this with the vaccine? Should he be scared? Should he even be sitting at home in isolation? All of these different things, and it just never completely made sense to me. And that was the thing that that ended up pushing me, amongst other things that happened in 2020, that pushed me into doing what I'm doing today. It was the refusal to ask questions. It was the denial of us asking questions, and just saying hey guys, this doesn't make any sense. And like you were saying, viruses are viruses, right? We've had, like you said, other coronaviruses. So why are you making this one so special? Now, from my understanding, and correct me if I'm wrong, there is something a little bit different with COVID-19 compared to the other coronaviruses. And I think that kind of comes into, is the gain of function research aspect of it, where it sounds like they, I don't want to say accelerated it, or maybe I don't know what's the right word to use, but it's not something originally they were saying, oh, there's some bats in China. No, this sounds like it was something that was kind of manufactured. Is that accurate?
So my expertise is not in whether there is how it came about.
Mhm.
So I can't answer that. I'm obviously disturbed with how people who raised the lab theory, they were completely silenced
Mhm.
because that was obviously the right question to ask.
Yeah.
But in terms of this, the pandemic is over now.
Right.
We're now in what's called the endemic stage. So we're going to live with this COVID-19 forever. It's going to be there together with the other 4 coronaviruses. And my expectation is in the long run, the 5 of them will behave very similarly. And that is that kids will be exposed to them when they're young and when this is not a serious thing for them. And then they will be re-exposed a few times, having a cold, like a regular cold, which the other coronavirus causes. So the thing that was different is that older people had not been exposed to this before, so the immune system hadn't been sort of prepared for it.
That's the thing. Okay.
And so once you've had it once, the first time you get it is sort of can be serious if you're old, if you're 70s or 80s or 90s, for example.
Yeah.
So it was a very dangerous thing for older people because they hadn't had it before. Now there's also this issue, like let's say 50 years from now, you're 90 years old, your immune system is going to be much weaker. So then maybe you will die from COVID-19 or from one of the other 4 coronaviruses or from the flu or some other virus, because a lot of old people, when the immune system goes down, they will succumb to one of the viruses that most people just will deal with quite easily.
Right.
So that could happen. But that's just like it has been forever, basically.
Yeah.
And so in that sense, I don't expect this COVID-19 in the future to behave very different from other coronaviruses. But it was different because we hadn't been exposed to it before, and that made it a problem for older people. Now, if you go to the 1918 pandemic for the flu, it was actually a little bit different because it was younger people who were at highest risk, and the older people had actually less risk. And we don't know for sure why, but I think the best hypothesis is that older people had been exposed to something very similar, let's say 50 years earlier. So therefore, they already had part of that sort of already then protected them because they had that protection, and they maybe get sick, but they will deal with it better.
Yeah.
While the younger people had not been exposed to something similar. And of course, there's going to be more pandemics, but we don't know what the next pandemic is going to be. But in a sense, we were lucky because when I first, I was scared of COVID for about 10, 20 minutes. Because as soon as it hit Italy and Iran, which were the first places there were like outbreaks, major outbreaks outside China, it was clear that this was going to reach the whole world sooner or later. So there was no way that we could ever avoid that. We were just going to do that. And so, of course, I'm a parent. I have 3 kids. So as most parents, I'm more concerned about them than myself.
Right.
So I quickly look at the data from Wuhan, and at this point in time, there had not been a single death in the US. I looked at Wuhan and I figured, well, people are probably exposed with the same probability, but most of the deaths were older people. And I don't think there was any child who had died from COVID. So I did some calculations as an epidemiologist and a biostatistician, and I quickly concluded that the relative risk of dying was more than 1,000-fold difference between the older people and the younger people. So it meant that we would have to worry about the older people, but we didn't have to worry about the kids. They could go to school, they could do their play soccer or baseball or go to their dance classes or whatever. So I wasn't worried about, because I knew they were going to be fine. I have an immune deficiency, so I was at somewhat high risk, even higher than most people in my age group. But I wouldn't have to worry about my kids; they were going to be fine. So, and you talked about your son. I was not worried about my son of the virus. I was worried about his mental health.
Yes.
So when they closed down the schools and stuff, I told him, go with your friends, go to them, play basketball with them, go do whatever you want with them. go hang out with them because schools were closed and he was home a lot. I didn't want him to sit alone in his room, and so I wanted him to be out and about. So I was pushing him to do that.
That makes sense. And I felt the same way when it came to my son as well. Um, he wasn't living with me. He was living with his mother, but I still saw him every weekend. But I would, but he's primarily at home with his mother. And I would say they were far more scared of COVID than I was, and even than my son was. And my son wanted to go see his friends and go outside and stuff like that. He kind of kept him in because it's the most dangerous virus they've ever experienced is outside. And in many ways, like I know a lot of people are angry at people who were a little bit too much concerned about the virus, but I actually just feel very sad for them.
Mhm.
Some online is cruel. People are anonymous and they're cruel about other people from their computer screens. But when I see people who are still wearing masks, um, just like some regular person who's just out and about, to me, I feel bad for them. Right? I don't want to mock them. Like I feel bad for them that they've grown so comfortable to this. Like it's like a blanket for a child, right? Like they don't want to let it go because they're scared. And I'm the thing that I'm upset at our public health system, at the media, the CNN showing the death clock, just like or the death counter at the bottom of the screen every day. Um, the company I used to work at, there's a guy that worked with me, and he would always talk about, oh, the Giants were playing, or the Yankees out there, and he would talk about the stats and stuff like that. COVID happened, lockdowns happened, and all that went away. And every day he started coming in and saying, "Do you have any deaths were in this county?" And that was what life was like. All the fun, all the spirit that existed was replaced by counting deaths. It was so grim. Um, and I but that's what was created for us. And it didn't need to actually happen.
You're right. And during the pandemic, a lot of the fundamental principles of public health were thrown out the window, and that's one of them that they were using fear. You don't do that in
Yeah.
public health. You have to be very honest with all the numbers and stuff like that, but you don't scare people. You don't use fear. You should do the opposite. You should try to calm people and be honest what the risks are, and then just be calm about it.
Yeah.
And it was a huge. One example is masks. So before COVID, we knew from randomized studies that masks was not protective against like influenza, which is sort of similar in many ways in terms of how they spread. And so you wouldn't expect the mask to work for COVID. There were eventually two randomized trials on masks for COVID. One was in Denmark, showed that didn't show any benefit. There was a second one from Bangladesh, where they actually, instead of randomized individuals, they randomized villages. So some villages were using masks, others not.
Mm.
And it showed that the masks reduced transmission between 0 and 18%. So either there was no effect or was minuscule effect.
Mm.
So that means that this is not a good intervention or protection, and we have to focus on other things. But the problem is that Anthony Fauci and others went out and said, put on a mask that will protect you. So now let's say you are 75 years old. You're being told by public health officials that I should put a mask, and if I do, I'll be safe.
Mhm.
Okay, I can go to the restaurant, the crowded restaurant. Well, no, the mask doesn't protect you. If you were 75 years old during the height uh, of the big waves, and that happened in the winter in the north, here in the north, but both in the winter and summer in the south of the US, you should not go to a crowded restaurant if you're 75 years old. You should go out and take a hike in the park instead.
Right.
That's a good thing, but a lot of people were told that the mask will protect them, And they thought so, and then they went out and about with the mask, where they maybe should have been more carefully at home.
Yeah.
Or outdoors rather than indoors. So I think actually this messaging, public health messaging about masks, actually led to death because people they thought they were safe when they weren't. So that you can't be dishonest with those things in public health. You have to be honest.
Yeah.
And if something doesn't work, you have to be honest and say, well, we don't. If you want to put on a mask, fine, but it probably doesn't help you, so don't rely on it. That's what the message should have been.
You know what's funny? At first, Anthony Fauci said, no, don't put on a mask. That won't do anything. And then,
well, I guess he was right then.
Yeah, he was right then. And then he changed his tune. Oh no, I just said don't put a mask on so we don't take it away from healthcare workers. And I was like, but that's not good either. That even like, if in his head, let's say he's telling the truth as to why he said what he said, that you lie to the public so you can save resources. Like, should you be lying to the public in the first place?
No, you should just say that we have a shortage of masks. We need to use it for these things.
Right.
And people, and most people most people are very good.
Right.
Most people would have said, okay, let's do it that way. But I mean, in this case, mask work. If you're a surgeon, you should use a mask when you operate.
Right.
Because you don't want something from your mouth to sort of land in the wound, in the open sort of things.
Right.
So surgical masks are very important for surgeons to use.
I mean, that makes sense. I don't know about us walking around, because I remember, man, it's so weird because it's like it's a different time, like a different era. Like I remember during lockdowns, I would watch like concerts, and I would see all these people standing next to each other, screaming, shouting at the music playing. It's like that was like COVID. Like it just seemed like a different era, even though it might have been 6 months ago. And now I'm looking back, and I'll watch I'm really into football or soccer, and I'll watch the Premier League games, but during lockdowns, and it's just nobody in the stands, and you hear the players shouting, and it's so eerie to watch. And I just remember during lockdowns, I was just excited to see something. I didn't care. But it's going back, it's like, man, we literally shut down society for quite some time. And hindsight is 2020, but at the same time, there were people like you and I who were saying, like, this doesn't sound right.
So I understand that we got certain things wrong.
Yeah.
One thing we got wrong was putting people on ventilators.
Oh,
Thinking
yes.
that would save them, but in fact actually kill people.
Yes.
And then it took a few months or half a year, and then people realized that no, this is not a good idea, and then it stopped. And of course, that's very unfortunate, and you shouldn't do things without proper evidence.
Mm-hmm.
But I understand that some errors were made. That's natural. And it takes time to sort of sometimes for politicians to figure out.
But the thing that was crazy was when they were sending people who were sick to senior citizen homes.
That was criminal. That was absolutely criminal.
It just never made any sense.
Makes no sense.
And it happened all over the country.
Yeah. And what was also bad, you can't stop debate. So they tried to close down debate on this, and by silencing and censoring, and if that doesn't work, slander and smearing. And that's something that should never happen, and there's no excuse for doing that, I think. We have freedom of speech for a reason.
Right.
And that is to get to good conclusions after discussions and debate for important issues. So freedom of speech is always important, but it's especially important during a crisis like this pandemic. That's when it's the most important to have freedom of speech. And I don't know what the founders, how they were thinking, but they actually wrote the First Amendment after going through a crisis of the War of Independence. So they knew that it is in a time of crisis that this freedom of speech is important. It came about after such a crisis. So it's not that they would have thought, oh, well, we should only have it in good times, and when in bad times or difficult times, we should suspend it. That's not, they wrote it because they had gone through bad times.
Mm.
They knew that they needed freedom of speech during bad times, whatever the reasons. And in this case, it was the pandemic. So it very worries me a lot that there are people in government who are very authoritarians. They don't want anybody to object to them. And it also worries me that there's a lot of members of the public who think this is okay to suspend the First Amendment.
Yes.
That scares me even more, actually. And my view is that if you have a scientist, like what scientist should you trust? And I have a rule for doing that. If the scientist is willing to debate with other scientists, then you should listen to them. If they're, you should always have a critical mind, but then you should listen to them. If you have a scientist who is unwilling to debate other scientists with different views, you shouldn't listen to them. Don't trust. It doesn't matter if they're a professor at Harvard or Stanford or wherever. You shouldn't listen to a scientist who's unwilling to debate their views with other scientists. And you mentioned, like, if you were against the lockdowns, you were accused of being a Trump supporter.
Mm-hmm.
So I had like a schizophrenic experience because I'm a native of Sweden, so I was part of the debate in Sweden. But in the US, I was on what the NIH to call the fringe,
mm-hmm.
against the establishment. But in Sweden, it was the opposite. I was actually in favor of the pandemic strategy that Sweden was putting in place. But there were other people in Sweden who were against it, who wanted Sweden to do the same thing as other countries. And there was like a group of 22 scientists. There was only one infectious disease epidemiologist, but like it was an ecologist, a mathematician, a climate scientist, and so on.
Mm-hmm.
They were pushing very hard, arguing against what Sweden was doing and wanting Sweden to lock down like the rest of the world. And they published their stuff in the major newspapers. And I disagree with them completely, and I wrote other op-eds to argue against them. But I'm actually very thankful that they wrote those things. They have the right to do it, they should have the right, but not just that. I'm also very thankful that they did it, because obviously there were other people who were thinking the same thing. So for them doing that, other people can say, oh, okay, I wonder about that. And then I could write and say, no, this is the reason why we should do it, the focus protection that Sweden is doing.
Mm-hmm.
And Anders Tegnell, the epidemiologist, wrote back, and others did as well. So there were several of us who sort of countered and argued for it. And I think that was very good, because then they got that debate. And people in Sweden actually have very good trust in, are very supportive of what the country did. So again, I'm not only think that they should have a right to say those things, I'm very thankful that they did. I think it was a very, very good thing, even though I completely disagree with what they wrote. And here in the US, it was not like that. And here in the US, I was accused of being like a right-wing extremist or something because I was against lockdown, which is very strange.
Right.
Because lockdowns are primarily hurting the hurting children and the working class and the poor and so on, the vulnerable of society. But in Sweden was run by a social democratic prime minister. So in Sweden I was like a left-wing fanatic, and here I was a right-wing extremist. So, and I'm just trying to do public health.
Right.
And I don't care who you voted for. I care about your health no matter what. And I don't care if you get sick from COVID, like for a few days and have to be in bed. I guess I'm heartless. But what I do care about is I don't want you to die, and I don't want you to be hospitalized. So, and I don't, doesn't matter who you are, who you voted for. In public health, we have to care about the health of everybody.
Right, exactly. And actually, you brought up the C word, class. There was always some sort of weird class element, which is why I always felt like the media didn't represent what a lot of people were feeling. So obviously, like there's people of different class levels who agreed and disagreed with us. So it's not to say that there was like this consensus between upper class and lower class, but there was a spreading of a narrative that just stay home. right? Just work off your laptop and stay home. And to me, that's the thing that only someone of a particular lifestyle would think that everybody is of that particular lifestyle. Like, obviously, someone's picking up your trash. They
Right,
can't
right.
do that from home. Someone's bringing you your food.
Mhm.
They can't do that from home. Someone's at the grocery store stocking the shelves. Someone's growing your food. They can't sit at home. And so it's okay if they risk their lives to come and serve you. But you can't, like, it was that disconnect that they couldn't fully comprehend, nor did they even attempt to understand that not all of us can do those particular things. Like for me, during the pandemic, nothing really changed for me. I went into the office every single day. I was driving on empty highways, you know, but nothing really changed for me. That was kind of like the bizarre thing for me. Same thing with my wife. She had to go in every single day, and nothing really changed. We had, I think, one small like little outbreak, and then we were like forced to stay home for like a week, but then we were right back.
Well, you understand public health better than most people. So maybe you should be a public health person instead of.
I mean, I'm just trying to to make sense of things, and that's what it kind of felt like. No one was trying to make sense. Everybody was just doing whatever was told of them.
We protected the laptop class,
Yes.
which I'm part of also, and we threw the middle class and the working class under the bus, and we threw all children under the bus. But those children who suffer the most from school closures are also the working and middle class. In the
Mhm.
upper class, they would send them to private school, like the governor of California did, or they would have hire a tutor or do pod schools, or they could afford to have one parent stay home and do homeschooling.
Right.
But if you're working class, both parents will still have to go to work. So this was this was the biggest assault on the working class since segregation and the Vietnam War here in the
Mm.
U.S. And I think anybody who was in favor of lockdowns was pushing that doesn't have any credibility to ever pretend to care for the middle class or the working class.
And I hate to bring up your old employer, but why do you bring up your old employer? Do you think that is part of why they were unwilling to hear what you had to say? Because for many of them, they're also part of the laptop class. And for them, it's like, well, yeah, all right, cool. I'll stay at home. My house is comfortable. I have the internet. I got a laptop. I can do my job. And they're like, why are these people fighting so hard to go outside? Right? Do you think that's part of it, or do you think some
Could
of it's
be.
political?
No, it could be.
It could be.
Yeah. And I think it was also political. So, but the irony is that because I have an immune deficiency, I was at higher risk for COVID than pretty much any other of my fellow faculty members at Harvard.
Hmm.
So that's the weird thing with it.
Yeah.
But I'm a public health scientist, so I can let my own situation dictate what I recommend for the whole country.
Right.
So I never sort of took that into account. That's just something that, okay, so I have this immune deficiency, so I have a higher risk for certain thing. Other people have other, uh, somebody has diabetes and then they're higher risk for other things. I don't have diabetes, so we all have different sort of uh, risks of different diseases.
Right.
So that's just something you have to accept. And then when you do public health is about not one disease, like COVID, it's about all diseases. You have to worry about cardiovascular disease and cancer and so on, mental health. It's not just about the present, also the future. So you can sort of, I don't, lockdown didn't save lives, but even if you could save a few lives now and then people die of cancer a few down the road, that's not a good trade-off. So you have to think not just about the present, you have to think about the long term also.
Mm-hmm.
And you can't just think about the laptop class, you have to think about everybody in society. You know, by the way, who are the most important public health workers?
No.
The garbage collectors. the janitors, the people who take care of like the water systems,
Okay.
and so on. They are the most important public health workers, and they kept working during the pandemic. And we should be enormously grateful for them for doing that.
That's a good point. I guess like the question of all questions, will this happen again as far as how we respond?
We will have a pandemic again because we'll have pandemics throughout history.
Right.
It could be 5 years from now, 20 years from now, 50 years from now, we don't know. But there will be more pandemics. I don't think they can lock us down again because there's so much, there will be so much pushback. I think they will try, but I don't think it will work. The people know what a disaster it was this time. And when we wrote the Great Barrington Declaration in October 2020 with Dr. Snetta Gupta at Oxford, who was the preeminent infectious disease epidemiologist in the world, and Dr. Jay Bhattacharya at Stanford, and then we had almost 1 million people co-signing it, including thousands of scientists and healthcare workers. But when we had that discussion back then, and what I was saying was that, well, with a few exceptions, I don't think we're going to convince any of the politicians.
Mm-hmm.
With a few exceptions, I don't think we're going to convince any of the journalists. With a few exceptions, I don't think we're going to convince any of the judges who are in courts making decisions. And with no exceptions, we're not going to convince any of the scientists who are leading the charge, like the science bureaucrats like Fauci or university presidents and so on.
Right.
The one we will be able to convince are the public because they're living this collateral damage. They see it firsthand. And they don't know as much about medicine and epidemiology as university faculty, but they're just as smart. So they can figure this out. So they're the one who's going to be convinced. And that's exactly what happened. It took a long time. It was a very gradual process.
Mm-hmm.
But more and more people realized what the mistake these lockdowns were. And then eventually, when the public changes, the politicians start to change.
Yeah.
Because they're actually very good at reading the public sentiments. That's what their expertise in. And then the media will also then eventually start to change. And also the courts, because the courts will in many ways follow the public sentiments. They sort of pretend that they're just following the laws, but they often decide things based on the public sentiment.
Yeah. I've always felt that I think we underestimate, like if people, let's say we're naturally selfish, right? And, because we care about us first, how we're doing, or maybe we care about our immediate family first. So if that's the case, and there's some virus that's going out, I think people are willing to discern how impactful this is or isn't, right? Based on their life. So like somewhere like out where we're at here, not a large population of people, it's very easy to kind of go about, maybe stay separate a little bit, but not, completely shut out stuff. There's less risk here because it's lower population. But like if you were going about here and you find out that your neighbor's sick, and that neighbor's sick, and that neighbor's sick, and then you're seeing certain things, then you react to it, right? You don't need CNN to tell you that you need to react to it. Like you would see it. They could report that there was a virus or something going on, but they don't have to add anything to it. And I think we underestimate our ability to discern what's dangerous and what's not dangerous. And that was the part, like for my son, he was confused because he's being told that this is the most dangerous virus ever existed, but yet he doesn't see anything, right?
Yeah.
And he's watching his dad go to work every single day, and he's fine.
And you still look like you're alive. So.
And they're still alive. And he's like, it's the confusing aspect. And then you look at certain people and they're panicking, but yet nothing is necessarily happening to them. Now, for me, I knew that there were people who died, but all of them were all of them were very sick or very old who had passed away from it. The same demographic that we were just talking about. So it's not to say that their lives don't matter, but it's to say that we should be able to discern, and we didn't need the spin from the media to tell us to discern this way. It's like, no. How about just like anything else? We should be able to discern, like, tell us that it's going to rain. Don't tell us that we're going to set a law that you have to wear rain boots and put it, bring an umbrella. Like, we can discern that actually all I'm going to do is just walk to my car. I don't need an umbrella. I'm just going to wear a light jacket. We don't need authority to tell us how to wear, wear clothing and to do everything after that. Just tell us it's going to rain. And they didn't do that. They told us there was a virus, and they set the framework for fear mongering and telling us what we must do. And then the politicians reacted to the media as well, saying, yes, I mean, this must be the only way. And it just so on and so forth. And no one trusted the public, because I think we're smart enough, because we're selfish enough, which is not a bad thing. We're selfish enough to say, I'm seeing stuff around me and I'm going to do something different, right? Because I see it. But, people who live in Idaho shouldn't worry about a hurricane in Florida, like they could discern, like, that's happening over there. It's not over here. We can do something different. And I just felt like that was missing.
So I think humans are both selfish, but also generous and compassionate.
Yes.
And I think a lot of people who were doing some of these lockdown things were doing it because they felt that that's what the right compassionate things to do, not realizing it was actually the other way around.
Mm-hmm.
Because they were told that that was some compassionate things to do.
Right.
So I think that I don't really want to blame a lot of people who did the wrong things, but I think I want to blame the people who were sort of sending the wrong messages, who were willing
Yes.
to listening to other things.
I agree. Absolutely agree. That's why I put so much more on politicians and people who are part of the media. I put more emphasis on them because they have the megaphone, right, to get the message to the masses. And we saw what happened when they had the megaphone. They set a clock or a counter for how many people were dying. They brought on Anthony Fauci. Anthony Fauci didn't find a camera that he didn't like. He went everywhere and talked about it and made it about himself and contradicted himself. From Anthony Fauci disagreed with Anthony Fauci. It was inconsistent. And we just saw all these people who were in positions of authority, who were setting rules and weren't living by them either. So, like, it was, for me, my blame goes to those people.
I want to point out here also that Anthony Fauci is not a public health scientist. He's a lab scientist. So he works in the labs with viruses and stuff. And Francis Collins, who was the head of the NIH at the time, is also a lab scientist. He worked with genetics. He doesn't do public health. So they don't understand public health. It was very obvious. They were trying to squash this one virus, not ignoring everything else. And actually, a few months ago, Francis Collins acknowledged that, yeah, we disregarded everything else. And that was a mistake. So he acknowledges that. But you have to then listen to other people who have other views. And during the pandemic, I mean, I would listen to Sunata Gupta and Devaracharya, but I kind of knew what they were going to say because they thought very similar to me.
Mm-hmm.
What I really was scrutinizing or reading very carefully was those who had a different opinion, because I need to understand them to know if they're right or not. And if they're not, I need to understand them so that I can argue against it.
Right.
So one always have to listen more carefully to people who have a different view. And I think they had no interest in doing that. So I told you that I met Devaracharya first time at the White House because Scott Atlas invited us to meet with both the president and the vice president.
Mm-hmm.
But Anthony Fauci and Deborah Birx were supposed to be at that meeting. Deborah Birx was the COVID coordinator at the White House. And they have now said that they deliberately decided to be out of town, that they were there because they didn't want to meet with us. And to me, that's just unfathomable that anybody would not want to discuss something with somebody who has a different views,
Right.
because that's what I want to do.
Oh, man. So we're nearing the end of this great conversation. I always ask people pretty much the same question. Are you optimistic about the future? And that can go in many ways.
So during the whole pandemic, I never doubted that we would be proven right, that eventually it will turn the tide,
Mhm.
because of the public. And if it wasn't for that pressure from the public, we would have had lockdowns for longer, maskings for longer, and vaccine mandates for longer. The only reason they didn't last for longer is that there was a pushback from the public.
Right.
So that makes me very optimistic, actually. And when there is a new pandemic will come, I don't think that they can lock us down. I think they have to do a much better job with everything to get the population on board. So so there I'm a very big optimist. I am concerned about the general tendencies for authoritarianism, because that really came through during this pandemic.
Yeah.
We have a small group of very authoritarian people in government and elsewhere, in universities and so on, who are pushing, who don't want freedom of speech. And actually, the government was the biggest purveyor of disinformation. But if you tell the truth against that disinformation, you were censored at the behest of the government.
Right.
And I was one of those scientists who were that. But I think we are kind of a tipping balance, where we will go down to becoming more authoritarian in the Western world, which I mean Europe and North America, or if we will go back to our tradition of freedom of speech and human rights and those things, which is sort of what built our civilization here.
Right.
And I'm very concerned because there are very authoritarian tendencies in the US, even more so in Canada, but also in the European Union. So in the US, for example, I'm a co-plaintiff in Missouri versus Biden, which was also named Murphy versus Missouri, which is the First Amendment case whether the federal government should be allowed to coerce and pressure a social media company to censor things that they don't like.
Right.
And we think they should not. And the government is saying that they want to be able to do that. So that was heard by the Supreme Court last week.
Hmm.
So we'll see what they say. But there's similar things in the Europe with the Digital Services Act, for example. They are actually, in many ways, ahead of the US in just trying to censor things on social media. And it is a concern. At the same time, it's a huge recognition that they are afraid now. Those who are in power are afraid, because if they weren't afraid, they wouldn't bother with the censoring. They would just ignore it. But they are now afraid that they're going to lose their control. So the fact that they are censoring is actually the highest praise I could give to us. So there are a lot of people who is trying to oppose this authoritarianism, and I think that's good.
Yeah.
And but I don't know. We're on the tipping balance now. It could go one way or the other. We just have to try work as hard as we can to make sure that we maintain these human rights and freedom of speech and democracy and so on.
Yeah. I'm generally optimistic myself. I'm a relatively optimistic person. I also agree with you that I don't think they'll be able to lock us down easy. Maybe if it happens a long time from now, where a lot of people forget.
Yeah, that could happen.
Yeah, and
that's why we have to get the history correct.
Yes, that's also important. So I think, in general, though, I don't think, like, if it was to happen 2 years from now, a lot of people would just resist, and even the politicians will be like, "This is unpopular. Like, we should not do it this way. Learn the lessons from the past." So I'm optimistic from that standpoint. I do see that there is a fight for the First Amendment, and what's happening with TikTok, for example, I think is one of those measures where they're trying to take control over speech. They say it's about China, but I think it's not really about China.
They try a small step at a time.
Yeah.
That's how they tried. So that's very concerning, I think.
Yeah, yeah. And I'm not even a user of TikTok, but I understand what they're trying to do, especially because I actually wrote a piece for the Telegraph about this.
Mhm.
You saw what they did with Twitter files, right? There was getting cooperation behind the scenes. They even had a portal where they could submit basically tickets, and say, hey, this user, do this with them, and they did it, right? They can't do
Yeah,
that.
I was one of those users.
You were one of those
Yeah.
users?
Yeah, they went, and I can trace it. We can trace it from the government too. Even censored.
And that's the thing. They can't do that with TikTok, but they want to, right?
Mhm.
Because TikTok is way bigger than Twitter now. So it's that power and control. Will they be able to accomplish grabbing hold of that? So as much as I don't like TikTok, I actually think that if they move forward with where they're going, um, the U.S. government will have some sort of grasp on it, especially when Mnuchin is talking about him and other investors buying it. Like, that's suspect. Someone who was part of the federal government, who has lots of money, is all of a sudden buying this. To me, screams that he might be friendly when the CIA or the FBI comes knocking on the door and saying, "Hey, play ball with us." But in general, I'm optimistic that people will fight for their free speech. And we have certain free speech fighters who are out there, people like yourself, suck your neck out as well. And some of us pay the price, and that's what it is.
Yeah, and freedom of speech is not just important for the persons who could be censored. It's actually more important for the people who want to listen. So I was censored when I talked about vaccines or masks, but other people were silenced or censored when I talked about the life hypothesis. And that's something that I don't know so much about because that's not my scientific expertise, but I want to know about it.
Right.
So I'm annoyed if whoever side they censor, I don't want that. But I have the right to be able to listen to various viewpoints on that. So if they censor other people, I am harmed.
That's a good point.
It's not just my rights that are violated when they censor me. They're violating my right when they censor other people who I want to listen to.
Well, that's a good note to end on. Thank you so much for inviting us into your home.
Thank you so much, Adam, for having me up here.
Yes, and I enjoyed the food. I didn't get to finish it yet, but I enjoyed the food as well. Thank you so much.
Did you like it?
Yes, I did like it. And you know what's funny? I didn't know you were going to eat shrimp. I'm not even usually a big fan of shrimp, but it was good.
Okay, thank you.
But thank you so much for, like I said, inviting me to your home and having this conversation. I really do appreciate it.
Thank you for doing this with so many other people also.
Yes, my pleasure.